and welcome to the maiden edition of the program Delta Health Insurance and You here on Delta Rainbow Television, DRTV Worry. I am your host. I am Nancy Onyebuchi. Now on this program, we are looking at the various benefits of being a part of the Delta Health Insurance Scheme, what it entails, all that it is for you to learn, and that can be done through the Delta State Health Insurance Scheme, and it's brought to you by the Delta State Contributory Health Commission. Now on today's edition, we are looking at the overview of the Delta Health Insurance Scheme, and we will not be doing that all by ourselves. But before we proceed, I'd like us to go on a short break, and when we come back, there is a lot for us to talk about.
My husband, no be Tessa be that.
Yes.
Shebi she talk say no money to pay hospital bills. Abi, she no wan pay the money when she dey home me since. Make I go meet her. Tessa, my friend, I dey happy say your pikin done well and you don discharge am from hospital. Tessa, you no wan pay me my money.
Thanks for your patience. I go pay you your money tomorrow morning. Talking about my pikin medical bills, I no pay 1 naira.
See as I wish say, na so e still be for adults.
Madam, that one na be equity plan.
Free medical services available for all residents of Delta who enroll under the Delta State Contributory Health Insurance Scheme.
And not just once you go pay very small money and you go get free treatment for the whole year. We dey call this one informal plan.
To prevent the burden of having to pay at the point of receiving healthcare services, especially in situations of limited funds, I think I like this informal plan.
Women, when register for equity plan under Delta State Health Insurance Scheme, when born through CS or vaginal delivery, now free medical services.
In fact, Market Men and Women Association, they enroll under the informal plan with small money and get free treatment for the whole year.
Na I be say, as I don't get belle so, na to go register with the Delta State Health Insurance.
As you don't get waiting, join the several.
Expanding health insurance coverage in Delta State.
You're welcome back from that short break. It's still the program Delta Health Insurance and You here on Delta Rainbow Television. Like I said earlier, we are looking at the overview of the Delta State Health Insurance Scheme. So now, what is it about? The Delta State Health Insurance Scheme is a healthcare insurance program in which individuals or group of people make monthly or yearly payments for healthcare services. Now, the idea of health insurance in Nigeria have been supported from the United Nations Children Fund, UNICEF, which has developed a draft position paper that highlights financial and pragmatic steps towards expand reforms in health insurance arrangements at the subnational level in Nigeria and its multiplier effect on the well-being of Nigerians. This is to say that with as little as 7,000 naira premium, an enrollee can get quality health care from any part of Delta State to prevailing ailments such as cough, catarrh, cold, diabetes, hypertension, or even surgeries when it is necessary. Interestingly, Delta State, according to the state governor, Governor Sheriff Ubewuri, have become one of the first states to implement the mandatory health insurance scheme in Nigeria with over 1.8 million enrollees, and the number is expected to rise even more. Now, you have heard a lot from me today, but I would like you to hear from the horse's mouth directly. And when I say the horse's mouth, I mean the Director General of the Delta State Contributory Health Commission, and that is Dr. Isaac Akpoveta. We will join him in an interview. Join us.
Do you live in Delta State and are you tired of paying expensive medical bills? I have good news for you. For just 7,000 naira a year, you can access quality medical care at any facility chosen. And this includes maternal and newborn health care, surgery, lab tests, eye care, dental care, emergency service, and lots more. You can also register and get your NIN at our head office for free. Now you don't have to break the bank to pay your health bills.
Expanding health insurance coverage in Delta State.
I doubt if I'm the big masquerade, but whatever you call me, I will see what I can do to achieve that. Big masquerade is a very big name. But coming to the commission, His Excellency, the former governor, the immediate past governor, saw a vision, and that without health, poverty will continue to bedevil our people. Without good health, man will become poorer and poorer. And I've seen it in the villages. Just one admission, they have to sell the only piece of land owned by the people for the family to treat one person. And so his governor said the only way to handle is health insurance. And by God's grace, I've been doing health insurance for many years, in decades now. And I key in with the governor immediately. And of course, like you said, we drafted a bill that became law. And after being law, I thank God that His Excellency, the former governor, wanted me to run the scheme and see how we can put together, transform the vision into a mission, into a solid physical structure that you can see. And today we have done that. For 8 years, or 7 to 8 years, I've been the chairman of the occasion. And within that period, between myself, Dr. Ben Ikechika, and His Excellency Dr. Okoa, who gave us solid political goodwill, solid support to run an health insurance, to start and run a health insurance agency. We became number one in the whole federation. At the time of November, December last year, of having 1.8 million Deltans, about 30% of Delta registered into the health scheme. That's a rare feat in the whole of, whereas second states, we'll be talking about 10%, 15%. Even National Health Insurance Scheme that's there about since 2005, it's only about 3 to 5%. And so this commission, Delta State Contributory Health Commission, has achieved a lot within a space of less than 8 years. And you see, His Excellency, the President Governor, Right Honorable Sheriff Oborevori, has been very close to the system. So he knows what this commission stands for. I wasn't therefore surprised that he took it up even stronger goodwill, political will to drive it even more than Dr. Okoa. And today, he has reappointed me as the Director General because he wants continuity. He wants more to be done. He wants stability of the commission. And I thank His Excellency for giving me this opportunity to, the baby that we nurtured now want to start to walk, and he wants me to be there to hold the hand of the baby to walk. May God bless him. But I promise Deltans that I'm going to seize this opportunity to do more, following the more agenda principle, to ensure that before, in the next 4 years, when this first tenure of the governor will end and his second tenure will start, we will have moved Deltans from 30% to 60%. And so that Deltans can get more good health. Health is wealth. And the first thing a man prays for when he wakes up in the morning is good health. And the governor, Right Honorable Oborevori, has promised to add more good health to Deltans. Yes, I'm happy that you are a health insurance expert already. Know that we have a demand side, which is where I sit today, and a supply side. The two must be harmonious. It's like a marriage between husband and wife. There must be a harmonious relationship for progress and peace to exist. For Delta to receive the best care, they need definitely a very vibrant, very efficient service side, with the general hospitals, the primary care centers, the private hospital, the access to finance hospital. About 530 or thereabout we have registered into the scheme. It has not been easy in that sector. You are aware of the disappearance of doctors for greener pastures abroad. what they refer to as Japa. So there is a lot of workload in the general hospitals. I do go there sometime in the night and see what is going on. But the present government has promised to see how we can increase the number of human resource for health, doctors, nurses, pharmacists, retain them, and then employ more, train more, and ensure that human resource for health can balance the demand for health services. With determination, nothing is impossible. Everything is possible with determination. And with the promise that more must be done, not will be done, must be done by this government, I'm sure that very soon we'll be holding meetings between us and the service side. We've been making sure that the private sectors are serious about it. And I'm sure in very near future, Deltans will smile in terms of good service care to them. Thank you.
My husband, no be Tesse be that.
Yes.
Shebi she talk say no money to pay hospital bills. Abi, she no wan pay the money when she dey home since. Make I go meet her. Tesse, my friend, I dey happy say your pikin done well and you don discharge am from hospital. Tesse, you no wan pay me my money.
Thanks for your patience. I go pay you your money tomorrow morning. Talking about my pikin medical bills, I no pay 1 naira.
See as I wish say, na so e still be for adults.
Madam, that one na be equity plan.
Free medical services available for all residents of Delta who enroll under the Delta State Contributory Health Insurance Scheme.
And not just once you go pay very small money and you go get free treatment for the whole year. We dey call this one informal plan.
To prevent the burden of having to pay at the point of receiving healthcare services, especially in situations of limited funds, I think I like this informal plan.
Women, when register for equity plan under Delta State Health Insurance Scheme, when born through CS or vaginal delivery, now free medical services.
In fact, Market Men and Women Association, they enroll under the informal plan with small money and get free treatment for the whole year.
Na I be say, as I don't get belle so, na to go register with the Delta State Health Insurance.
As you don't get waiting, join the 7.
Expanding health insurance coverage in Delta State.
Like the DG rightly said, with determination, anything becomes possible. So with this determination, the Delta State Health Insurance Scheme, they are determined to get as much enrollees as possible, and that is why the T-SHIP program was introduced. That is the Tertiary Institution Social Health Insurance Program, and it was launched in various universities. But firstly, it was launched at the Denis Osadebe University, Asaba, to enlighten students and to ensure that they get quality access to healthcare facilities in their various schools.
Today we are here for the Tertiary Institution Social Health Insurance Program. I'm aware that a student gets sick, you get admitted, you have to do an operation like appendix, your parent may have to cover 200,000 to 300,000 naira. But with this scheme, you only need to pay 7,000 naira and you get that free. And if the clinic cannot handle it, they will refer you to a higher center, like Federal Medical Center or a specialty hospital, to receive care. Again, very, very important, we are discussing with other states across the federation that any student from any other state have the need to attend the hospital urgently. With your card of Delta State Health Commission, you can walk into a clinic registered for the Health Commission of that state and receive care.
Addressing over 1,000 students of Denis Osadebe University Asaba at the flag off of the Tertiary Institution Social Health Insurance Program, TISHIP, Director General of Delta State Contributory Health Commission, Dr. Isaac Apoveta, assured students of tertiary institutions that the scheme will ensure they receive quality health care in their clinic and other health facilities within and outside Delta State. Dr. Apoveta stated that with the Tertiary Institution Social Health Program by the Commission, the health care of students is covered with a subsidized premium subscription of 7,000 naira per annum. The Director General, who commended the State Governor, Right Honorable Sheriff Obugori, for supporting the initiative, also thanked the Vice Chancellor and management of the university for partnering with the Commission in launching the program. Chairman, Governing Council of Delta State Contributory Health Commission, Dr. Austin Obidi, enjoined students of Dennis Osadebe University, Asaba, and other tertiary institutions to subscribe to the TRSHIP scheme, which will be of immense benefit to their healthcare needs.
Indigenes who are resident and schooling in Delta State will benefit immediately. But if you are indigene of Delta State and you are outside schooling and you are back home, you can also buy that card. And with the card, you can receive treatment any hospital that is registered by the scheme in Delta State.
The Basic Healthcare Provision Fund is basically driven by the federal government, and all states benefit from it.
Vice Chancellor of Dennis Osadebe University, Asaba, Professor Ben Ogojafo, represented by the Deputy Vice Chancellor Administration, Professor Christopher Chukwuji, expressed gratitude to officials of Delta State Contributory Health Commission for kickstarting the TRSHIP scheme with their institution, saying the program will address health challenges of students in tertiary institutions.
We are here about the health insurance scheme for the students, especially because for the staff, the same persons that are here, the officials from the contributory Delta State Contributory Health Scheme, are earlier on visited us and captured all the staff. So this is the turn of our students to key into that contributory student health scheme.
Some students of Dennis Osadebe University, Asaba, who enrolled in the TRSHIP scheme, commended the Commission and Delta State government for the initiative, stating that they would not need to travel back home to access quality health care.
The money will be reduced and it has many advantages, like people will not have to struggle to look for huge amounts of money to go and register another hospital. But with the help of this scheme, I think people will be more happier.
You know, going back home to take a medication from our parents will be another cost of money. So, but with this privilege the government have already granted us, we can have access to the medical center and take treatments at least to sustain us for the meantime.
It's like our parents around them, those that are outside Delta. I feel it will help us to ensure that we are okay.
High point of the ceremony was the presentation of award of Health Insurance Ambassador to Dennis Osadebe University, Asaba, as well as commencement of online registration process for students of the institution.
Wow. So you see, the Delta State Health Insurance Commission are in for real business, and they intend to cut across all sectors and groups in the country. Well, up next for the program is the daily health tips for you. And today we are talking about water. Yes, water, very common, but as essential as life itself. You saw it. Water, very common, but as essential as life itself. You can never underestimate the use of water in our body system. Well, with that, to come to the end of our program today. Plenty thanks for being a part of it. I am Nancy Onyebuchi. Remember to stay safe and get your health insured. Bye for now.